The importance is keeping consistency of care based on your personal risk factors for breast cancer, whether you don't have anybody in the family with that or not. Genetic studies are showing us more and more often that even co-cancers in other areas of our bodies, colon cancer, ovarian cancer, can be linked to other genes with breast cancer. We need to have someone checking on you every year, either with your annual, with your primary care, or with your OBGYN. Someone needs to be ordering you a screening mammogram. One standard imaging technique can't tell us everything we need to know. So the value at the 3D is if you have dense breast tissue, maybe you have large breasts, small breasts, anything, it can give us accurate pictures of detecting cancer earlier, help us to focus on images if we need more of them, and overall just give us a better image and quality.
It's really not that bad.
Girl, it was not bad at all whatsoever. You just basically have to get into a particular yoga style position, and it's just a little bit of pressure, not a big deal, not painful, much better than that was expected.
When patients arrive, they are given paperwork to fill out, and they're escorted to a registration desk where they will review demographics and given an armband and taken back to the testing area.
Right this way.
Thank you. Stickers.
We will then start with your mammogram and take 2 to 3 pictures of each breast. Once we are finished with your mammogram, the radiologist will then read it.
The screening mammogram is typically something that we get in patients who are completely asymptomatic, those without a palpable mass, those without a history of cancer, those without a strong family history of cancer. Those are typically the ones that will require a screening mammogram, typically starting at the age of 40. A diagnostic mammogram is when a patient comes in with a palpable mass or a strong family history or a history of cancer, and they need a more thorough evaluation of both breasts.
And then we do a special view, which is a 3D tomosynthesis view, which is a little bit more sensitive to look for subtle calcifications or subtle distortion of the breast parenchyma, and both of those look normal, so I don't see any reason for you to come back for any additional imaging. This looks like a normal screening mammogram.
If it's a normal screening mammogram, we'll get a letter in the mail with the results. In addition, it will be posted on the electronic medical record as well. If it's abnormal, they will typically get a phone call from one of our nurse providers to come back for additional imaging.
If you're one of those people that found themselves without a doctor, the breast center does a self-referral. Anybody, everybody, in any location can get a mammogram yearly. And if you do not have health insurance, District 4, Health Department, there's no reason we can't help take care of you, whether you have insurance or you don't have insurance. We need to have someone checking on our ladies every year, no matter what. And this can be anyone from your primary care physician to your OBGYN. It can be even the health department with District 4. The importance of it is that someone is always checking on our ladies, always making sure that they have access to care.